All right, well, welcome everybody into our second EHANZ webinar of this year. My name is Tanya Morrison. I'm the National President from New Zealand Institute Environmental Health, and I'm joined with my counterpart and National President of Environmental Health Australia, Melissa Byrne. Thanks for the wave, Melissa, and between the two of us, we'll be co-hosting this webinar today to celebrate the International Day for Disaster Risk Reduction. The theme for this year's day is Fund Resilience, Not Disasters. I think we can all get on board with that. All right, so we're going to kick off today, starting on our side of the ditch in New Zealand. It is my pleasure to introduce our first speaker, which is Aidan Milner. Aidan is joining us from the Auckland Emergency Management team. He has a Master of Science and degree in geology, and prior to joining the Auckland Emergency Management team, has worked as an engineering geologist on a range of major infrastructure projects across New Zealand. He's also led projects such as the re-evaluation of Auckland's hazardscape from an emergency management perspective and the severe weather response plan. His presentation today is going to pose a very good question for us of a team of 5 million in New Zealand when a third of our population is sitting in Auckland. So with Auckland having a population of 1.7 million, how would we actually be ready for a possible volcanic eruption when at least 1 million of those people may have to evacuate? That and more challenging questions I'm sure you'll pose to us. It's my pleasure to welcome in. Good afternoon to you, Aidan.
Hello. Yeah, thank you very much for that intro, and no pressure, right? Got to look after all of New Zealand, but what could go wrong? Okay, well, I've got myself a little timer here, so if I go over, just give me a wave and I'll try and keep to time. But yeah, first of all, very big thank you to those who have organised today's webinar. It's a really big privilege to come along and present to you all today, so really thank you for that. And yeah, as said before, so my name's Aidan. I'm the Hazards and Warnings Advisor here at Auckland Emergency Management. So we're the emergency management part of Auckland Council that forms the council that's part of New Zealand's largest city here as well. So as sort of said in the introduction, yeah, definitely we've got a fair share of challenges here that we've got to work through, but I think today is going to be a really interesting time, I guess, to give my perspective on what I think today's disaster risk reduction theme means for me, especially someone who's got that emergency management lens as well. So we'll whip into it. So yeah, as said before, today's theme is fund resilience, not disasters. And when I sort of sat down and was having a bit of a think around what does this actually mean to me and what should I talk about today, the first thing that came to mind, no surprise, having worked in an engineering background previously to this, my first thought was, hey, let's think about, funding better infrastructure. Let's think about actually making sure that we're building in places that aren't in floodplains, for example, and all those kind of things, strengthening building codes. But when I sort of sat back and thought, actually, from an emergency management perspective, what does it actually mean? I think it's actually a lot bigger than just that sort of physical infrastructure, and a lot bigger than just the stuff we I guess we think of traditionally. So when I sort of sit back and look at it as a whole system approach, I sort of think that actually resilience is actually a really big, I guess, combination of factors. So in a couple of slides time, I'll show you some key, I guess, concepts that we use here in emergency management. It might be familiar to some of you, might be new, but I'll talk around I guess, how we break up emergencies and what we I guess, think of the different phases are and stuff as well. And I guess that's where I'll sort of maybe challenge some thinking in terms of, hey, it's not just that physical infrastructure, it's the system as a whole, potentially as well. So what I'm hoping to talk about today, so I'm going to obviously outline some key emergency management principles that I talked about before. I'll give a bit of an overview to the New Zealand emergency management framework and some of the systems as well. I won't dive super heavily into that because that could be a whole webinar in itself. We'll just sort of set the scene a little bit, and then I'll talk around some of the work that I'm doing in terms of the emergency management risk assessments, because again, one of the key themes that I think I'd want to get across today is we can invest money into things, but we want to make sure we're investing it wisely, and we want to make sure that we're actually understanding what our risk is before we really I guess, start diving into some of those problems and stuff as well. And then one of the case studies I'm really keen to use today is actually a project that's very recently been finished here in Auckland. So we've been looking at changing our tsunami resilience here. So I'll sort of set the scene in terms of what that looked like prior to our project and some of the steps we've gone through. And it's quite a nice example to sort of wrap it up, where we go from most of the different stages of that emergency management concepts And you can sort of see how we've sort of tried to make sure that we're actually having an equitable solution for people as well. So that's what I'm hoping to do today. I'll touch on the volcanoes a little bit as well, but again, I only have 20 minutes, so there's only so much I can say in that time, but I'm sure there'll be some good questions potentially that come out of that as well. So those key concepts that I was talking about. So this might be familiar to some of you. If not, I'll just do it quite briefly. So this picture, I've got to make sure I'm using my mouse in the right place. So this picture here kind of shows, I guess, how we can conceptualize how an emergency might happen. So it goes right through from us understanding what our risk is and understanding what our risk profile is. So that's in that reduction phase up here, which is the one, I've just realized you can't see the mouse come through. Okay, you'll bear with me. So the reduction one up on the top of the screen there, that one, to me at least, refers to when we're thinking around that sort of infrastructure side of things, right? It's sort of making sure that we're not building in places we shouldn't be. It's making sure that we are understanding our risks and our hazards, and it's also making sure that we, I guess, have policies and procedures in place as well. So that's really us kind of, I guess, doing what we can to mitigate the hazard before it happens. But then as we move around this diagram, you go to that readiness phase, which is the one that I work in quite a lot now, especially working in the emergency management space. So that readiness phase is quite important because I guess one of the problems that we deal with here in Auckland, and I guess pretty much everywhere around the world has, right, is we can look at how we, I guess, plan for the future in terms of our land use, but we are also kind of inheriting, I guess, things from the past, right? So, for example, here in Auckland, we had quite severe floods in 2023, and there's a lot of properties that were built in some of those floodplain areas that, to be fair, probably shouldn't have been consented or aren't in the best locations. And while we can potentially move, buy those properties and look at how we, mitigate the risk to some of those, we're never going to be potentially, I guess, able to do that for every single hazard. So we're going to be able to plan for the future, but we've also got this problem of we've got people who might already be exposed to risk because of our choices that we've made in the past, right? So that's where I think that readiness piece is really important, because we can prepare those people to, I guess, know what some of the natural warning signs are, and we can also prepare them to try and, I guess, respond appropriately so they are potentially not as much, what am I trying to say? I had a really good line and that's gone out of my head. We're basically trying to make sure that they're going to be, I guess, at least risk as possible, even though we can't necessarily, I guess, potentially remove their house or their property from harm's way, if that makes sense. Then that response side of things, obviously, that's, when we actually respond to the emergencies, and that's when hopefully that reduction in that readiness phase has really worked, and hopefully we have the, see the minimal impacts as possible, but, we'll see what happens on the day. And then recovery, which is that last phase there, is a really important piece, and that's kind of, I guess, where that nice link between the lessons learned and, I guess, trying to work out, okay, did our models work? Can we mitigate some risk of hazards that maybe didn't get as much, I guess, exposure as they potentially needed to in terms of our understanding and stuff as well. And that's where that sort of cycle kind of rebuilds itself. So that's sort of a big sort of nutshell of some of those key principles. And I think resilience, you can really bring that into every single part of that. So it's not just at that reduction phase as well. So setting the scene very quickly for Emergency Management New Zealand. Again, some people on this call, this might be pretty, you might know it already, so just bear with me. But for those of you who aren't so familiar with what we've got here in New Zealand, I guess just like in Australia, a lot of our country is divided into different council boundaries. And within those council boundaries, we've both got city councils and regional councils as well. So both those councils have responsibilities and emergency management responsibilities. So the city councils are obviously looking primarily at the city itself and those urban residents, whereas those regional councils are more looking holistically at the region and potentially some more of those sort of rural populations as well. However, in Auckland, we're a bit different. So our councils got amalgamated, I think, back in 2010, and we're now one really big council. So there's a couple of different councils across New Zealand that are like that. So I think Marlborough, Gisborne and the Chatham Islands are similar, where it's just one council, but that council fulfills multiple roles. So we do both kind of city council work, but also regional council work as well. So from an emergency management perspective, that's quite unique, right? So we've got to think about both our rural population, but also our urban population too. And they both have very different levels of resilience, and they've both got different needs as well. So it really makes some interesting thinking when you're sort of looking around, I guess, how hazards are going to impact people and how we're going to respond as well. So some key documents and all that kind of good stuff for us. So one of our key frameworks or things we come back to here is obviously a nice bit of legislation. So this is the Civil Defence and Emergency Management Act 2002. So this pretty much sets out the area of responsibilities. So it says that as a civil defence group, we're in charge of responding to geological hazards. So that's the likes of tsunamis, volcanoes, earthquakes, all that kind of good stuff. And then infrastructure related hazards. So that's basically, damage to major utilities like power outages, water failures, all that kind of stuff. And then also meteorological hazards too. So that's your likes of your flooding and severe weather as well. Another key thing it does is obviously outlines our powers during an emergency. So if we declare a state of emergency, what can we do? And primarily it's around evacuations as well. And then it's got some stuff around governance and setting up like strategies and plans and stuff as well. Another key document here in New Zealand is the National Disaster Resilience Strategy, or NDRS for short, because that's a really catchy title, like lots of good policy is. It's always got nice names, right? But this is a really key and great piece of policy here. So this aligns quite closely to the Sendai framework, and again, is really in line with the theme of today. So it's really, I guess, kind of encouraging people to make risk-based informed decisions, and to really, I guess, quite a cool thing that this document does too on point 3 there is it actually encourages a lot of, I guess, policy making to actually consider things like climate change adaptation too, which is really cool to see that we've got a national piece of policy that's actually encouraging that type of thinking as well. So that's quite good. Another document we've got here is our local emergency management plan. You just have to be with me, I'll just have a glass of water. So this is our group plan. So this is kind of like a local version of the NDRS strategy, if you like. So this document is each civil defence group around the country has to have one. And this document basically outlines what our risks are as a region, where we see some of our vulnerabilities are, and pretty much outlines, okay, what are we going to try and do in a 5-year period to try and, I guess, address some of those vulnerabilities and make our communities stronger as well. So again, another kind of legislative piece of work that we have to do to make sure that we're investing in that resilience as well. And it also talks around sort of our governance structures during a response, and talks about our operational side of things as well. So if you're keen to have a look at it, there's some nice pictures in there, which is always good. Makes the reading all right. And finally, another one of our key documents here is our Coordinated Incident Management Systems. Again, another catchy name, but we've got an acronym for it. It's called SIMS. I think in Australia, you guys use the AIM system as well. Again, it just talks around how we respond during an event. And it's really one of the key principles behind this document is, again, trying to make sure that we're really meeting those community needs as well, and just making sure we're actually serving the communities we're here to respond to. And quite interesting, it's quite flexible as well, so we can sort of adapt the system to meet our needs. So here in Auckland, we've got a really diverse population, probably one of the most diverse populations in New Zealand. So we've actually made a response structure that's actually called culturally and linguistically diverse communities. So it's actually a group of people whose whole job during the response is to make sure that the messages we're putting out, all the things we're doing a response, are actually considering some of those diverse communities that potentially might not necessarily have a voice during a response as well. So that's quite cool that we can sort of adapt it to meet those needs. Right, so we'll get on to the meat of the presentation today. So talking around, I guess, how we can apply that investment and resilience principle. So one of the key things I think when I'm thinking around kind of investing in resilience is really, if you want to invest in it, you've got to actually sort of understand what your risk is to start with, because you want to make sure that you're doing wise investments, especially working for a government organisation. You're dealing with public money, right, as well. So there's a bit more scrutiny around how you're spending that as well. So one of the ways we do that here in Auckland to understand what our risks are is we actually conduct a risk assessment. So I've got a really amazing diagram in the next slide. You're in for a treat with my graphic design skills to show how it all links. But essentially what this process is really designed to do is it's designed to look holistically as a region and kind of work out, okay, what parts of our region are at risk from different hazards as a start, and also what hazards are going to pose the largest risk to our region as a whole. So there's kind of two parts to it. So the way we do this is we take a scenario for our different hazards, and we make sure that that scenario is developed with subject matter experts in that area. So it's as realistic and, I guess, as we incorporate our most up-to-date thinking on that hazard as well. And then we take that hazard and we assess it at a workshop with a range of different experts, and we work out what the impact of that hazard is going to be across a range of key indicators across our city. So we look at key metrics in the social domains. That's looking at people who might need welfare support, people who might need financial support, people, what the impacts might be to people's health as well. So that's an area we look at. We look at what the impact is going to be to the physical built environments. That's like the hard infrastructure as well. We also look at what the impact is going to be to the natural domain and the economic domain as well. So we sort of sum all of that up, we get an overall risk rating, and then we get a likelihood score, and that gives us our overall risk rating as well. But the really interesting thing, and you'll have to hold your pants for my great diagram here. See, I'm not only a geologist, but I can make diagrams too. How good is this? So basically what this diagram I'm hoping to show here is that these kind of two processes are interlinked, right? So our risk assessment should not only identify the overall hazards and what our big kind of, alarm bells are for our region. But the hope is we'll also, identify, themes and maybe communities that are at risk throughout these different, hazards as well. And the idea is it's supposed to be linked to that kind of document that we produce as a group. So that way we've sort of got this continuous improvement where we're always trying to identify with the new science and the new thinking and lessons learned from past events. We're always trying to think about, okay, what's happened in the past, what might happen in the future, and is there any, parts of our community that we potentially haven't, kind of identified or thought too heavily about from in the past for a range of reasons, and how can we help this community as well? So that's kind of, our big picture of how we're hoping to, invest more into that resilience piece as well. But I'll go into a case study for the last few minutes of this presentation as well. And I'm going to use tsunami as an example, just because I said before, again, we finished a big piece of work in this space as well with one of my colleagues here as well. So if you're not aware, New Zealand, we've got quite a big tsunami risk here. So essentially, this is our big picture situation. New Zealand sits on the edge of the Pacific Ring of Fire, which not only is a great name for a disaster movie, it actually refers to the area where the Pacific Plate, which is that big kind of blue bit in the middle where the Pacific Ocean sits over. That's a big tectonic plate. But once that tectonic plate hits the Australian plate on the New Zealand boundary, that's actually an area where we get a lot of earthquakes and volcanoes as well. So that picture to the other side, kind of zoomed in on New Zealand there, you can see the North Island, which is where we're located. We're quite close to that big tectonic plate expression on the surface, if you like. So that's called the Kermadec Trench. Now that area can create pretty significant earthquakes. So recent scientific drilling has found evidence that it could actually produce earthquakes of magnitude 9+. So that's not a good day for us here in New Zealand, but that's also not a good day for us here in Auckland as well. So if we have an earthquake on that fault line and it creates one of those major earthquakes, and we'll probably see tsunami waves hit Auckland within about an hour or so, which isn't great because Auckland, we've got a lot of coastlines. We've got like 3,100-ish meters of kilometers, of coastlines. So it's a pretty decent amount of coast, and people in Auckland love to use the beach, especially in the summer, just like in Australia. Love to go down to the beach, kind of use that sort of coastal environment. And if we get one of these events happening, it's obviously not going to be good because the coast is going to be quite busy. So the state of play. So prior to us doing this piece of work we've recently completed or in the final stages of completing, we did have a tsunami warning network across New Zealand. So we had some tsunami sirens that were dotted around the coasts. But the problem is these sirens were installed probably about 10 years or so ago. And the technology's moved on. It's become quite degraded, unfortunately, as well. And in some places, people have actually been stealing the sirens to put on their cars, which is not great. So that means that some of these communities are actually potentially more at risk if they're relying on this piece of technology, right? So we wanted to address this. We wanted to go, okay, what has changed in the alerting technology space? So what can we improve? But also, has our risk changed? How have our populations changed as well? So the piece of work we did first of all was we wanted to understand what's going on with our tsunami zones. So we did a bit of modeling. So we engaged a consultant to do some pretty complicated tsunami modeling that involved a lot of physics and a lot more kind of realistic ways that the waves would interact with the land, which was more advanced than what we'd done in the past. And the good news was, instead of our risk going up, our risk actually decreased in some places, which was really positive. and shows why, revisiting these hazards all the time with the new science is really important. We also moved away from 3 evacuation zones to 2, just because it was easier to communicate to the public as well. So now that we knew that some of that risk profile had changed, we're like, okay, what does this actually mean for those communities? So the next thing we did was we did a really comprehensive vulnerability study, and we believe it's actually possibly one of the more comprehensive ones that's actually been done in New Zealand in this space, which is really cool. So we got the Crown Research Agency to use a modelling software, and we looked at both the social data, but also like our physical data as well. So looking at GIS information around where roads are, hospitals, all that kind of stuff. And we looked at, okay, once you all take all of that into account, you run the tsunami up onto the land, what areas are actually going to be more at risk? Because we wanted to make sure that we were making sure that whatever I guess system we installed in the future was actually going to be really equitable. We wanted to make sure that the people who are, I guess, more at risk, and potentially sometimes maybe what our work found out as well, that those communities are actually a bit more isolated than some of the, I guess, more vocal areas as well. We wanted to make sure that these people who might not necessarily always have a voice are actually getting, I guess, the help and support that's actually required as well. We wanted to make sure that all of our recommendations were based on science and sound principles as well. So once we had done that piece of work, we then did a cost benefit analysis to work out, okay, what's going to be the best option for putting different technologies in different places, and I guess sort of what's coming up in the technology space that we can utilize. And we also wanted to make sure that whatever we're installing was actually really robust as well. And we just landed on this report, which was actually endorsed by our committee a couple of weeks ago, which is really cool. And it actually looks at all the different regions across Auckland and actually presents a mixed base solution based on its risk profile. So we had a baseline, pretty much like a baseline standard for everything that pretty much said, there's a minimum level of, I guess, resilience and support that should be put in across the board. But then some of those more high risk locations, we had more bespoke solutions as well based on all of our work. So that's quite cool, I guess, a really good example to show that once you actually invest in, I guess, that science and understanding that hazard, you can make sure that that resilience funding is actually equitable across the place as well. And then just a final plug for the old volcanoes before I finish up here. So Auckland, we sit on a volcanic field. So we've got about 53 volcanic cones that have erupted in the past across our city. And, the science says that we might be potentially due for another one at some point in time, but that location and the impact of that is pretty uncertain. So that presents a pretty big risk for Auckland. So a piece of work that we've been doing here is we've actually partnered with the university and some other research agencies here in New Zealand. And this has actually been going on for about 17 years. And we've been working with this consortium that we've created called DEVORA, which is Determining Volcanic Risk in Auckland. And the main purpose of this group has actually been to provide that sort of science advice, that hazard modelling, and that sort of, I guess, research and informed information to go into all of our plans and documents that we've been working in the space as well, which is again another plug for, I guess, one of the main things I'm sort of trying to get across in this presentation is I think understanding your hazard is sort of the first step in that resilience building space as well. So to sum up, I think investment into resilience is more than just that physical infrastructure. It's sort of that whole emergency management sphere. So it's investing into your plans, it's investing into your risk reduction activities, and it's also, I guess, understanding what that risk profile looks like as well. And I think one of the main, I guess, takeaways or things to remember is that the community should always be the main focus of our work, and they should always be, I guess, the main beneficiaries of any investment we make in this as well. So yeah, that's pretty much me. So open to questions.
Awesome. Thanks so much, Aidan. Question that comes to mind for me, it's really interesting when you say how you've looked at the risk and the science and actually done some more work as the technology and things update, even going down from 3 evacuation points, as you mentioned, to 2. You mentioned how if there was a sizable earthquake, that it might be around about an hour or so warning before the tsunami hits. I mean, this is not a go at Auckland traffic at the slightest, sitting here in the South Island of Dunedin as I am, but I mean, is an hour enough time when we think about resilience and really our ability to react to safely get as many people out of harm's way as possible?
Yeah, that's a good question. So one of the big things that we did with this project was we were looking at not only, I guess, the physical alerting systems that we can put in and how we can, I guess, get messages out quickly, but another big piece is actually, I think education becomes a really big piece of that as well. So I think one of the findings was actually we need to have education programs across Auckland to make sure that people understand those natural warning signs as well, because you're right, if we have under an hour, by the time the earthquake's assessed and we start to look at those threat maps, we don't have a lot of time to warn people, right? So I think that's why, again, working with the community and making sure the community is also empowered to make their own decisions as well is such a key part of that too.
And is there a frequency to that? I just think along the lines of how constant that messaging and education might have to be, because, this is a scenario that you can't exactly run a fire drill on, so to speak. We can practice in an earthquake drop, cover, hold. We can practice responding to alarm to get out of a building, but how do you practice a mass evacuation? You really can't. So, what's the frequency of those messages to make sure people still kind of have an inkling of knowing what to do if an alarm goes off?
Yeah, that's a good question too. So we run a national shakeout day here in New Zealand. So I think it's actually coming up in a couple of weeks' time. And that's where we sort of have a tsunami hikui event, if you like. So we encourage people to say, hey, have a look at your evacuation zones and work out, if you're at work or if you're at home, where would you actually go? But again, I guess living in New Zealand too, you're aware we've got so many different natural hazards here, right? And the response to them could be all slightly different. But I think that's where we sort of come back to, I guess, our consistent messaging. So we make sure that the messages we put out are almost hazard agnostic to a degree sometimes. So I guess the basic preparedness messaging and the basic, I guess, make a plan, work with your family, all that kind of stuff is sort of spans across all the hazards, if that kind of makes sense.
Yeah, absolutely does. I mean, we use the same messaging, whether it's local flooding or what it might be. So I guess all scales of it, and that's what you were talking around, that risk as well, which is quite important to keep using the science and keep that analysis up to date to know how we can be as planned and prepared as possible.
Definitely.
Awesome. All right. Well, thank you very much, Aidan, for your presentation. It's really interesting just to hear, particularly with the most up-to-date plan with Auckland. I didn't actually realise your one was 24 to 29, so that's very here and now in terms of your civil defence emergency management plan, which is really interesting. So
yeah, definitely. No, cheers. Thank you.
Cool. All right. I'll pass you over now to my co-host. Welcome in, Melissa Byrne, the President from Environmental Health Australia.
Thanks very much, Tanya. Next up, I'd like to introduce Jenny Luke to present. Jenny is Acting Manager of Disaster Management Branch in Queensland Health, seconded from her substantive role as Emergency and Resilience Manager at Westmoreland Health. And beginning her career as a paramedic in Victoria and Queensland, Jenny has spent the past 12 years specialising in health disaster management, and she holds a Masters of Public Health focused on disaster preparedness with published research on hospital infrastructure resilience. In her HHS role, Jenny works across prevention, preparedness and response and contributes to sustainability and climate change initiatives, advocating for resilient health systems and infrastructure to ensure continuity of care into the future. And her presentation today is on From Response to Resilience, Protecting Our Health System. So welcome, Jenny.
Thank you, and thank you for having me on this International Day of Disaster Risk Reduction. It's exciting to be here, and one of those topics that's kind of dear to my heart, both academic. So why are we here? So as we've seen, climate change is contributing to an increase in natural hazards across the world, with frequency and intensity increasing exponentially, one would say. Particularly, stats from 2024 have shown that there was over 10 disaster declarations made across Australia, and I would assume similar across New Zealand, with some research coming out last week telling us that about those disasters cost the community around $2.2 billion, which is about a 65% increase from the year before. So as these events increase, they're directly affecting our hospital and health systems' ability to respond, impacting our aged care, our primary care, and disrupting those environmental determinants of health, including food safety, water safety, and our sanitation systems. So research shows us that these events amplify existing health inequities and test the limits of our systems, and something that I've been firsthand knowledge of. It is clear that we need to change how we focus our response from simply just responding from crisis to crisis to moving towards a state of systems that are built to anticipate, adapt, and then recover from these impacts, and thereby improving our community's resilience. So how do we build resilience in our health system, and what are some of the things that we've done in the past few years? So prevention and preparedness, just as Aidan said, is really important in that first line of resilience. So how do we prepare our communities? How do they know what their risks are? How do they understand their own health to try and reduce that burden on the health systems when disaster strikes? To do this, we need some cross-sector collaboration across hospitals, our public health units, our environmental health professionals such as yourselves, as well as that community-based resilience collaboration. And not to discount the need for resilient infrastructure. I'm sure we all know that our infrastructure is at risk, and as many of our hospitals in Queensland tend to get older, they're more at risk of these disasters. So just sharing some lessons that I've noted over the last few years in Queensland Health, and those impacts and how we've needed to move from response to anticipating needs. In 2016, I was involved in Cyclone Debbie, which impacted our North Queensland coastline. I was working in Townsville at the time. And in this disaster, it was the first time that we in Townsville, and indeed probably the state, needed to actually send multidisciplinary teams to our colleagues south of us down in Mackay. So this was the first large-scale multidisciplinary team deployment across borders. Something that was hard to do, but was necessary to be able to put in clinical and non-clinical staff into a hospital multiple hospitals along the coastline that were directly impacted by Cyclone Debbie. The lessons we learnt from these impacts are still serving us today as we build from an ad hoc system to a planned and prepared deployment system across Queensland. I'm sure we all don't want to hear the words COVID-19 ever again, but COVID-19 really proved that it was really important for public health and emergency management sectors to work in harmony and collaborate with our primary care systems to respond and recover from a novel virus. And research has shown that the strong governance and cross-sector collaboration in this event were key to success. So as we've said, cyclones and floods and heat waves are becoming more and more prevalent. And our lessons from these events, which hopefully we may learn, is not only identify, include the need to actually prepare our communities to actually understand their risk and what it means to their health if they're unable to get to healthcare because they're isolated by floods, or are without power for critical periods of time. And certainly in the last few years, places like Brisbane have experienced long-term power outages, which have tested the abilities of our health systems to actually respond to said issues. Earlier this year, Queensland Ambulance has worked in partnership with Queensland Health to support the Western Queensland hospitals and health services, whose buildings were impacted by floodwaters that was in exceedance of anything that was could have occurred in the past. At a national and state level, where there are multiple insights to disasters, with the Commonwealth Disaster Ready Review in Australia, it was clear that from this review that we need to strengthen the role of our primary care and GPs to prepare our community members and to work in collaboration across our public health and units who have prevention embedded within their frameworks. Focusing on risk reduction across the whole health system includes integrating our aged care, disability and community services in district and local disaster management groups here in Queensland and across Australia. Ensuring our stakeholders within the health system have accountability for ensuring community preparedness and safety and wellbeing. It's not just Queensland Health and it's not just the health services across Australia that have responsibility for this whole of system response. So in my time in Queensland, I've seen some good practice examples of how we can really integrate these lessons. As we know from COVID-19, the governance is essential. And within my own health service, we've integrated disaster management, climate change and sustainability planning groups to ensure that we're not reinventing the wheel and that each of us are building on each other's work. In multiple health services across Queensland, we see that district and local management groups that have primary responsibility for disaster management are establishing health system subcommittees, which include both public and private partners from the local area, with an agenda to share information, build capacity and educate the community to alleviate surge on hospitals, ensure GPs and pharmacies can continue to operate or are able to recover quickly to service the community in a timely fashion. Residential and aged care planning is improving, although we're not there yet, but the new aged care standards are motivating our providers to ensure real plans are developed and tested to ensure that evacuations of residential aged care residents are not just simply let's send them to the closest evacuation centre, but rather working with their sister agencies or other providers to find suitable accommodation and avoid our elderly sleeping on the floor. In the Queensland Department of Health, we're working across emergency services and critical infrastructure partners to build our heat management and engagement campaigns. This year, we've seen our state's Transport Authority engaging in heat wave disaster exercises that have been really engaging and really considering the whole impacts across all government on what a heat wave would do if prolonged. So I guess I'm here talking to environmental health providers and professionals. And it's clear that the role of EHOs is critical in that disease prevention, surveillance and response, as well as climate sustainability engagement. The work of EHOs and public health units on a daily basis is developing networks and supporting councils so that when things do go sideways or go wrong, there are established connections and support. And those of us that work in disaster management know that these pre-existing connections and collaborative approaches are key to ensuring a good outcome from disasters. A couple of Christmases ago, the Mount Tambourine storms led to the community being without power for quite some time. And this community is actually quite isolated when this occurs. And it was the public health and environmental health units that were supporting food safety, water safety and sanitation requirements, and thereby reducing health impacts to the community, identifying environmental risks before they became health crises. Health Protection Branch in Queensland has recently updated a suite of community fact sheets and worked with the Queensland Strategic Comms Branch to come up with some fun and innovative media graphics that help to communicate with the community around bushfire safety, tank water safety, and other food safety issues that occur after power outages. So in looking ahead, I believe that we all can work together to expand our disaster prevention and preparedness roles. Building an integrated community health of practice and protection networks is key to ensuring that we're moving from just that simple response mode into a resilient system. In West Moreton, I work with the environmental and public health teams to invest in creating a sustainable health service And we're fighting for the resilient infrastructure through research-driven initiatives and programs. So for me, together we can build and protect our communities to be more resilient. And I know that sounds just like a tagline, but I do think that it is possible if we do work together to protect our health systems, working across public and private initiatives and stakeholders to really build and prepare for those disasters as they occur. And that is me, probably done in time early, so thank you.
Thanks very much, Jenny. We do have some questions. So based on your work assessing healthcare resilience during events like the 2025 Western Queensland floods and the COVID-19 pandemic, do you know if or how AI applications such as machine learning for real-time surge forecasting or automated community needs mapping help Queensland Health proactively reduce the strain on systems from intensifying climate risks?
Wow, that's a good question. So I'm not aware of directly the use of AI in that anticipating and preventing risks, but certainly our public health units and environmental health units are looking at how we use AI to really look at surveillance and driving information. Certainly moving into the Olympic Games, this will be something that we're really trying to develop more and more, I would assume.
Yep. And does sustainability include focusing outside health for adaptation?
Yeah, so certainly within Westmoreland, our sustainability program does look at our public and private partnerships and what's working well outside of health. We're looking at, how do we use now I've lost all words. So how do we sustain power through alternative power generation and looking at good practice from outside? Obviously, it's clear that, private partnerships and stakeholders have better initiatives than Queensland Health at times. So we do try and leverage off some of that.
Yep. And probably from a Queensland perspective. Last question. What mechanisms currently exist or do you think are needed for better coordination between councils and Queensland Health in disaster risk reduction?
Sorry, I missed one of the words. Could you say again?
What mechanisms currently exist or do you think are needed for better coordination between councils and Queensland Health in disaster risk reduction?
So I think in Queensland, we're really lucky that we're a locally led disaster. We have a locally led disaster framework. So it's our local councils that are actually ultimately responsible for disaster management within Queensland. So we do leverage our local disaster management groups, which Queensland Health are members on. And then legislatively, Queensland Health, including public health, as two separate entities. So the sort of health in hospitals and then public health, the community side, are legislated to be on district disaster management groups as well. So we do have good collaborative mechanisms. And I think in the last little while since the review at a national level, all councils have been encouraged to have those health system working groups established, which Queensland Health have championed.
Lovely. Thank you very much for your presentation today. And next up we have Wendy Gambley. Wendy has a Bachelor of Applied Science Environmental Health, a Graduate Diploma in Education, Secondary Science, and a Master's in Health Services, Emergency and Disaster Management with distinction. Wendy is a Fellow of EHA, President of the EHA Victorian Limited, Vice President of EHA National, and a faculty member of the EHA Queensland's Environmental Health Disaster Management course. She has worked in local government as an environmental health professional, promoting the profession locally, statewide and nationally for over 30 years. And Wendy has worked on the front line as an EHO in leadership, policy and legislative roles, and working across the full range of environmental health activities in local government over 3 states. She's committed to raising the profile of environmental health and works tirelessly to contribute to enhancing the health and wellbeing of all communities. And her presentation today is Planning Resilience on Mitigating Disasters. Welcome, Wendy.
Thanks, Melissa. Really appreciate that. Thanks, everyone. And thank you to Jenny and Aidan as well. I'll hide my video because it is a bit glitchy. Might help. Okay. So as an EHO, I always start with definitions. And I'm going to get rid of that out of the road. So we're talking about resilience, about communication. So what does that mean to us? I went whatever dictionary I had right beside me at the time, and it was the Australian Pocket Oxford Dictionary, 4th edition. Now, normally we'd go to the Macquarie Dictionary in Australia, but I didn't have one of those. Resilient is resuming its original shape after compression, readily recovering from shock, illness, etc., being buoyant. And to mitigate is to make less intense or severe. So what does that mean to us? It's about making the consequences of a disaster less intense or severe. That's the mitigation. It's allowing our to bounce back, and that's the resilient part. So it's nothing new. It's nothing unbreaking. It's something we do all the time in everything we do every day. From going affecting a food business to finding out, we know about Build Back Better schemes, and I talked a little bit about that. This resilience, this mitigation also goes into play with our safe evacuation centres as well. So the mitigation and resilience, as Aidan alluded to, actually cuts across our entire PPR. So when we're planning, preparing, responding or recovering from a disaster or emergency, we need to build mitigation and resilience across all aspects of that. Your disaster is happening, it's unfolding, the fireys or the SES are responding to it. As EHO, we're putting in the evacuation centre. We're making sure that they're safe so that we then don't get disease transmission within the evacuation centre. We're providing resources, making sure that people understand what's going to happen. A fire goes through, we want to clean the roofs, make sure they've got fresh water in their rainwater tank, clean water so they can go home if they still have a house. And the resilience part of that is not just the resilience of the community, but the resilience of our teams. So we have to make sure our EHOs, our local laws officers, our animal management team, everyone that comes together as the environmental health team at local government level has the skills and knowledge to know what to do, that they can rely on themselves to know that they can do this. We need to build that resilience in our people and to know that they've got people they can call on, the phone a friend. In terms of, it's about making further disaster. So when someone forgets to shut the plug on the fire retardant and they drive from one airport to another in a rural area and they spill fire retardant all over the road, you don't want another emergency happening on top of the bushfire you're dealing with, because that product is incredibly slippery, can cause motor vehicle accidents. So the resilience and mitigation needs to be planned into everything that we do, right across your PPR. So planning resilience, we have a number of plans in Australia. So local governments have an emergency or disaster management plan, and that is, like Aidan pointed out, with New Zealand, where you identify the hazards and the consequences of those hazards. So it's an earthquake likely to occur in rural Victoria, and what is the consequence of it happening? So what are your major hazards in your local area? Some of you may have environmental health plans. If you don't, I'm encouraging you right now to make them. Could be simply a couple A4 pages where you identify different documents that you already have in place that you can roll out. So for instance, your mosquito management plan. Flood comes through, you have a mosquito outbreak, you've got a mosquito management plan that determines whether or not you are actually going to do education or whether you're going to do larviciding or adulticide. So that can be in your environmental health plan. Often you'll have an evacuation centre plan as well, that outline how the evacuation centre operates. As EHOs, you may be involved in setting up an evacuation centre, but at the very least should have a role going in and checking, sure the evacuation centre is set up properly, and that if you do get a disease outbreak, can you isolate those people to prevent the gastro running through the entire centre. And don't forget animal management. So you should have an animal management sub-plan to your evacuation centre plan. What are you going to do if people bring their cats, their dogs, their lizards, their snakes, their chooks, their horses, dogs along to the evacuation centre? You need a plan for that. Obviously, pandemic, epidemic planning is essential. We've just seen that, and bring on the learnings from what we've seen in COVID. Biosecurity planning, a lot of you may not have been involved in this, but if you're in rural or semi-rural local governments, it's important to make sure that you're across biosecurity planning and know hazards are. In Australia, we've already had JEV, which is a biosecurity and public health emergency or disaster. The Department for Agriculture is anticipating a major animal biosecurity issue within Australia within the next 5 years, and they are planning for that. Business continuity plans at local government. You have a business continuity plan. A lot of it around whether or not the internet and your computer keeps running, but it's really vital that you are involved in that. Sure that when something is happening, you have access to the information, resources, and data that you need to get access to. And the last one is your recovery plans. They are created once a disaster, once the thing starts, response starts, and then a little while into the response, you'll start to see someone creating a recovery plan. So that is how does the community bounce back from the flooding. Road fix. Food businesses may need to be inspected, to be reopened, that sort of thing. So how are we going to do all this? You need to know what is happening in your organisation in relation to emergency and disaster management, and you need to get your voice heard at that table from your environmental health team. Know your community. At local government, you're very good at knowing your community. At state and federal level, it can be a little bit harder, but you have EHOs at the local level that do know their community. But you people that are out there knocking on businesses' doors, knocking on people's own doors, and you've got those other people within your environmental health, local officers, animal management officers can assist you. Go beyond your business as usual. Don't just constantly concentrate on your inspection and complaints that come in, but stop and think as a team, what is it that we need to think about for emergency and disaster management? Learn, listen, and grow your emergency and disaster management knowledge. You mitigate every day. Believe in yourself and become resilient, because you are the people that are vital to ensuring a resilient community. So Environmental Health Australia in Queensland run the Environmental Health Disaster Management course in Townsville every year. It's around the July-August period, and we've just had one. It is open to all everyone in Australia, everyone in New Zealand. We had some lovely gentlemen from Papua New Guinea come along as well. Can you flip to the next one? Oh, that's it. Any questions?
Thanks, Wendy. I'll just give
That's all good.
a few moments to put any questions in the chat. On the very left-hand side there, second from the left, I thoroughly enjoyed the disaster management course and really do recommend if anyone can get a chance to go to it, because it's a very valuable 6 days of intensive learning, but great experience and skills that you get from it and great connections that you can make as well. And Wendy, just for those who are listening and who watch a bit later, if you're a new EHO or a cadet and you're starting out, you know, who can EHOs go to, and where's their first starting call if they would like to try to get their voice raised within council and be more involved in their disaster resilience planning?
Yeah, so hopefully you're in a team that has other EHOs at council, but sometimes you're not. So it's important, if you're the only EHO in your local government, to reach out to the EHOs in the other local governments around you. Now, in Queensland, they have group meetings, and in Victoria, and a couple of the other states, they have SIGs. Melissa, Tassie, you guys have SIGs, do you?
We have our regional meetings with our EHOs.
Regional meetings, yeah. And so for those who don't know, SIGs are interest groups, so there might be one on food safety, environmental protection. So reach out to your neighbouring local governments and have a chat to your disaster management or emergency management officer in your local government. They're really lovely people, and they, if they don't know what environmental health does, when they learn what you know, they'll be very, very happy to have you on board.
Great, and we do have another question. Another question is, communication is vital during an emergency. What steps have been taken to ensure connectivity between agencies?
So that's something that different agencies work on all the time. So as EHOs, one of the key things you need to do is make those connections before a disaster. Build a communication network before a disaster. So even arranging a regional meeting on something that's a business as usual topic, to get to know the people in your public health unit, in your Department of Agriculture, Department of Environment, whoever they may be. At a council level, for disaster management, they have regular meetings between the disaster management officers and CEOs and the district levels. But as EHOs on the ground, get your networks connect before there's a disaster.
Thanks, that's great advice. Thank you, Wendy, for your presentation today, and thank you everyone for your presentations for this year's theme from Resilience Disaster. It is a powerful call to shift our focus and resources towards prevention, and we often do talk about emergency response, but as we've heard here today, it is our everyday efforts that keep disasters from escalating into public health emergencies, and this resilience doesn't happen without investment. So I do encourage everyone to remind your decision makers, including your local councils and politicians, that funding resilience means funding environmental health professionals and the vital health protection work that we do, because as we all know, when we invest in prevention and resilience, we save lives. So thank you, and I'll pass over to Tanya to close the event today.
Awesome. Thanks so much, Melissa, and thank you again to Aidan, Jenny, and to Wendy as well. Apologies, we did have some sound issues there with Wendy's connection at the end. If that's not in terms of risk reduction for a possible disaster on Zoom, then I don't know what is, but we got there in the end, as we always do in environmental health. We find a way. So thank you so much, everybody, for joining us for our International Day of Disaster Risk Reduction webinar. We look forward to seeing you all again for our last EHANZ webinar coming up later this year as well. Ka kite, and have a great afternoon/morning wherever you may be. Thank you again.